Doctors often lack the training necessary to help their patients stop using tobacco products. That's according to Dr. Judith Mackay, author of the 4th edition of the Tobacco Atlas, which details the effects of tobacco use on healthcare and the global economy.
There's traditionally been very little training about tobacco other than perhaps the disease that it causes. There's very little training in cessation, so what happens is that all these health professionals go on to start working and they haven't got confidence, they don't know what to do in order to help their patients quit. They might say to them smoking's harmful, but there's a whole manner of tips and advice and groups that can be set up, pharmaceutical agents that can be used where countries can afford it, that can really improve those quitting rates. But if you're not trained in knowing them and understanding them and how to use them, there's a massive gap there between the needs of the patients and then the actual ability of the health profession to basically help them.
She added that doctors are the most obvious advocates for anti-tobacco programs, and yet they often aren't trained to do so.
There's no teaching of advocacy. Doctors are not taught how to make a representation to a finance minister to put the tax up. They're not taught how to run a press conference. They're not basically taught how to do interviews like I'm doing at the moment. This is not part of any of the undergraduate or postgraduate training that doctors go through. And yet what can be more important than getting our health messages to the right people, whether they be government or whether they be the media?
The report also linked tobacco use to $96 billion in direct medical costs in the United States alone. Keith Hansen, the World Bank's Director for Human Development in Latin America and the Caribbean, added that smoking is a self-inflicted burden on the healthcare system.
Health expenses put many, many families into poverty. In Latin America and most countries, after unemployment, it is the largest single cause of household bankruptcy. It also puts tremendous strain on the state, which has to pay for expensive health services much earlier than it should if we prevented these illnesses. And of course, it's a tremendous drain on the health system.
The most simple level to do is to take lung cancer, heart disease, and chronic bronchitis. Take the percentage of those caused by tobacco. For example, 90% of lung cancer, 75% of chronic obstructive airways disease, about 25% of heart disease, and you can calculate it. It's almost a back-of-the-envelope calculation. Of course, it's more complicated than that, but it's actually remarkably easy to look at some of these costs and to work them out. Even a very poor country, perhaps without a health economist at all, is able to get some kind of assessment as to how much it's costing the country. And the answer is it's costing it a lot.